This short video will demonstrate how to approach patients during the WA Point Prevalence Survey. Before you start, you should introduce yourself to the nurse coordinator of the ward as a surveyor. He or she will let you know which patients are not suitable to survey and where patient admission information is kept. Importantly, you must wash your hands in view of the patient before and after speaking to them.
Good morning.
Hi, my name is Susan Jones and this is Sally Peterson. I work here at the hospital as a nurse and Sally is from the Department of Health. We're part of a team carrying out a survey of all public hospital patients. The survey focuses on improving the standard of healthcare being provided. The survey won't take long and is quite straightforward. It involves us asking you a few simple questions and us recording your responses. Do you mind if we ask you a few questions?
Have you received the patient information leaflet about the survey? It may have been given to you at some time yesterday.
Yeah, the nurse gave me a copy. I've had a quick look at it.
The survey involves a skin assessment, which includes us checking your skin for pressure sores. Are you happy for us to check your skin?
If the patient doesn't give consent for a skin inspection, the survey can still be undertaken, but will exclude pressure injury assessment. If the patient is unable to give consent, then the patient's carer or nurse can provide consent for the skin inspection. If the patient is unwilling to participate in the survey at all, thank them for their time, wash your hands, and continue with the next patient.
Yeah, I'm happy for you to do that.
Great, thank you. Nothing in the survey will affect your course of treatment here at the hospital. It's also confidential and your privacy will be maintained at all times. Have you got any questions?
No, I'm happy to be involved in the survey.
To start, we need to check your identification bracelet and then we'll ask you a few questions. Alex Salmond?
While conducting the survey, there are a few items you'll need to check. Firstly, you'll need to look at the patient's identification bracelet. Secondly, you'll need to view any intravenous lines that the patient has. You'll also need to find out if the patient is using any mobility aids, such as a walker or wheelchair. If the patient has consented to the skin inspection, you will need to conduct a head-to-toe visual inspection for evidence of any pressure injuries. You'll need to draw the privacy curtains around the patient's bed before starting the skin inspection. You will also need to refer to some paper-based tools which are available at the bedside. These are usually kept in the file at the end of the bed, or are sometimes found on the wall nearest the bed. The file contains current versions of the patient's medication chart, medication history and management plan, nursing care plan, comprehensive skin assessment tool and wound management plan, and falls risk assessment and management tool. Once you have completed the survey, it's important to thank the patient for their time and remember to perform the appropriate hand hygiene technique as you leave.
Thank you so much, Mr. Salmond. Thanks for your time.